I wanted to talk a little bit about combining music therapy with a wound care program that we have at Woods Hospital. And this combination arose because I had heard about our wound care program and that our patients were experiencing, or like most patients in a wound care program, experiencing pain, anxiety during wound care. And so hearing that, I thought, well, maybe my skills as a music therapist could assist with this. So I approached our wound care nurse and I said, you know, this is something I'm thinking about. I could come into the patient's room, play some guitar, sing with them, try to engage them in the music to see if they could have any less reduced pain or any anxiety. Because I know just from the research that I've read that is something that music therapy can offer. She was very open to it, so we looked at her caseload that she currently had, and there was a patient that she said, I think this will be perfect. He's experiencing a lot of pain during the wound care. So we both went in during her next wound care session, and I engaged the patient, you know, talking to them a little bit about what kind of music they like, and choosing some songs that I knew that the patient also knew, and he responded very positively. He engaged right away, started singing with me. At some points during the session, he was experiencing a lot of pain and was and shouting out. So we would include that in the music therapy. I would play he liked some rock and roll, so we played some rock and roll music, and he was like shouting out the words, the lyrics, while he still experienced all that pain, and hopefully experienced less because of that. And so anyway, we continued with that patient and expanded to another patient, and depending on what the patient's preference is, sometimes it would be like that the patient was very actively engaged. Sometimes they just want some background music, so what I'll do is just play some background music while they're having their wound care. But the comments from the patients are that they feel less pain. They feel like the wound care session takes less time, which in fact it really doesn't. But the engagement in the music will give them that perception. And they also they tend to look forward to it. You know, it's a kind of a special occasion. I'm in there with them, and they can design the music specifically to what they want. So I might not know every song, but I could try to get something that they're familiar with, and make it personalized for them. And so that's been going on for about a year now, and it's been a nice combination because it's an area where I hadn't applied music therapy, and it's a combination, you know, with the rehab therapy department and nursing department of coming together and really collaborating for some solution.